Are you struggling with knee pain after a meniscus tear, wondering if you can heal it without surgery? My name is Faris Solomon. I got my degree in the study of human movement, and I will go over what causes meniscus tears, how to prevent them, and an exercise program to help you go back to an active lifestyle. Let's go. The meniscus is a C-shaped piece of cartilage that acts as a cushion between the femur, which is the thigh bone, and the tibia, which is the shin bone. It plays a crucial role in shock absorption, stability, and even weight distribution across the knee. A meniscus tear happens when a cartilage is overstressed, either through acute injury or gradual wear and tear. Acute injuries are common in soccer, basketball, and football, where players have to change direction quickly. As for gradual wear and tear, it can be seen in older adults who experience degenerative changes in the knee, weakening the meniscus over time. As for the most common causes of these meniscus issues, first, activity injuries with sudden pivoting, twisting, or impact sports. Second, deep squats and heavy lifting, especially by inexperienced lifters with excessive knee flexion under load. Third, trauma from a direct hit to the knee, like through falls or collisions. Fourth, degeneration, because cartilage breaks down over time, which can increase risk of injury. Fifth, poor joint mobility and weak muscles, which can lead to imbalances, increasing the stress on the meniscus. Now, the rehab program will be divided into 3 phases. Early rehab, weeks 1 through 2, and the focus will be on managing inflammation and starting to improve flexibility, as well as activating key muscles safely. Strength progression, weeks 3 through 5, to strengthen key muscles that help support the knee without adding excessive stress. Functional strength and stability, week 6 and beyond. The goal here is to improve balance and knee control to prepare for real-life movement. Let's get started. The first exercise is a knee extension stretch. Lie flat on your back with your pain-free leg bent for support and injured leg extended. Have a band looped around your foot and gently try to straighten your knee without the movement becoming too painful. Hold that position for 30 seconds and then release slowly. That's 1 rep, repeated 3 times. This exercise works to restore full knee extension, which is essential in maintaining proper joint alignment even during simple activities like walking. The second exercise is a knee flexion stretch. Lie on your back with both legs extended. Slowly bend the affected knee towards your chest, bringing your heel closer to your body without getting too close to the point that it becomes painful. Hold that position for 30 seconds and then return to the starting position slowly. Repeat this motion 3 times. This improves knee flexion to start restoring mobility needed for everyday movements like walking and climbing stairs. The third exercise is quad sets. Sit with your affected leg extended and then tighten the quad muscles and press the back of your knee downwards. Hold that contraction for 5 seconds and relax. That's 1 rep, go for 10 reps. This activates the quads early in the recovery process, preventing muscle atrophy and helping stabilize the knee joint while reducing pressure on the meniscus. The fourth exercise is straight leg raises. Lie on your back with your injured leg straight. Engage your quads of your affected leg and lift it up about 12 inches off the ground. Hold for a few seconds and then slowly lower it back down without letting it drop. That's 1 rep, go for 3 sets of 10 reps. This strengthens the quads and hip flexors, essential for knee stability and preventing excessive movement that could aggravate the meniscus. The fifth exercise is hamstring bridges. Lie on your back with both knees bent and heels on the floor. Press through your heels and lift your hips up towards the ceiling. Hold for 1 to 3 seconds and then lower back down in a controlled way. That's 1 rep. Keep going for 3 sets of 10 reps. This strengthens the hamstrings and glutes, reducing stress on the knee joint and improving overall lower body stability. The sixth exercise is side-lying hip abduction. Lie on your side with the injured leg on top and the bottom leg bent for stability. Keep your top leg straight and slowly lift it upwards without rotating your hips, and keep the toes pointing forward. Hold for 1 to 3 seconds at the top, then lower back down slowly and with control. That's 1 rep. Repeat the motion for 3 sets of 12 reps. This strengthens the hip abductors, which help control knee alignment and prevent inwards knee collapse, a common cause of meniscus injuries. The seventh exercise is elevated heel raises. Stand on an elevated surface with your feet shoulder width apart. Slowly lift your heels coming up onto your toes and hold for 1 to 3 seconds at the top, then lower slowly to drop below the level of the step in a controlled way. Then rise again. That's 1 rep. Go for 3 sets of 12 reps. This increases calf strength, which helps absorb shock during walking and running, reducing impact on the meniscus while also improving ankle stability for better weight distribution across the knee joint. The eighth exercise is step-ups. Stand in front of a low step or sturdy platform around 6 to 8 inches. Step up with your injured leg pressing through the heel. Slowly bring the other foot up to meet it, and then step back down with control and leading with the non-injured leg. That's 1 rep. Go for 3 sets of 10 reps. These step-ups build single leg strength, improve knee control, and starts restoring functional movement patterns, making activities like climbing stairs, standing, and walking easier. Preventing meniscus tears revolves around protecting your knee from excessive stress and strengthening the surrounding muscles to improve joint stability. First, strengthen leg muscles because strong quads, hamstrings, and even glutes helps with shock absorption and increasing joint stability to reduce the stress on the meniscus. Second, improve balance and stability because better balance, especially through the hips and ankles, help lower the risk of awkward landings and twisting motions, which can lead to tears. Third, warm up before physical activity because stiff joints and unprepared muscles can increase the risk of injury. Fourth, wear supportive footwear, which can improve shock absorption, and avoid misalignment, which can increase the stress on the knee. Fifth, listen to your body and avoid overuse injuries, which can happen through repetitive knee motions and high-impact activities without proper rest and recovery. Rehab from a meniscus tear takes time, but with the right program, you can regain strength, stability, and confidence in your knees. Focus on proper form, progress gradually, and listen to your body. So as always, stay active and mindful.